Practicing nutritionist. I teach in a college. I also work with Nutri-Tech. Nutri is my part. But my half of my work is nutrition counseling. So I run a clinic in the evenings. So I'm a practicing nutritionist. And I face practical problems about soy and its myths and how I explain to my clients why it is good and why all these, most of the myths are not based on any evidence. So there are a lot of studies coming out on soy, almost 2,000 per year, and it's been for a long time. See, my master's was in foods and nutrition, and I worked on effect of soybeans on cholesterol, okay, in rats. Now, that was in 85 to 87. Now, please don't start back calculating my age. I'm very young. I got a lot of double promotions, so don't calculate it. It's all wrong. So, I also did on soybean. Suresh also worked on PhD in soybeans in 1950s, I think. So all of us worked on soybeans for a long time. Now, and we've been talking about anti-nutritional factors and everything from then onwards. And one thing I've learned is this is a lot of thing is scaremongering. When you say something is bad, you get more attention than when you say something is good. So everybody who comes to me, is refined oil bad? You are supposed to eat 5 teaspoons of oil. In that, how much hexane is there, how much this, don't overthink it. You know, just if you stick to 5 teaspoons, it is fine. So most of it is fear-mongering or scare-mongering, because when you scare people, especially on social media, you get a lot of attention. Now, first thing is soy as an allergen. Now, I've been working from 2001 on soy up till 2010 solely on soy. After that, I've moved to other things. But I have never seen anybody who is allergic to soy. I know so many people who are allergic to groundnuts, besan, other types of nuts, but not really soy. I haven't seen. And also when you see the list of foods to which people are allergic, 90% people are allergic, soy comes somewhere in 8th place. Okay, in case you are allergic to any soy product or soybeans, don't eat, simple. There are so many people who are allergic to eggs and besan and all, but same way if you are allergic to soybeans, then don't eat it. Simple solution. And also start reading labels, because soy is added to a lot of products where you don't really think soy is there. So that's the only solution for soy allergy. But what I wanted to tell you is it is quite rare. And some children, if they do have allergy also, 70% of them grow out of it. And nothing I'm saying is from my experience or anything. These are all evidence-based. All the references are given in the presentation. Phytates, sir already covered, Dr. Shashikiran already covered it. And my clients come and they will talk to me about, not much about soy. Phytates means wheat. So they come and tell me, give me gluten-free diet. I'm like, why? Have you tested? No, gluten, if you eat gluten-free diet, I will lose weight. Phytates won't be there. Like, they know all the points, but they don't know how to connect it. So I'm like, okay, you tell me what is your problem, weight loss or diabetes or something. Let me do my job. Na? If you are going to do the job also, then you don't come to me. So people have a lot of knowledge from social media, but they don't know how to connect it. So that is where professionals come into picture. So if you are taking a balanced diet where there is sufficient amount of iron, you are cooking the soya beans where phytates are lost, and then you add little bit of lime juice, you will not get iron deficiency. So first look at having a balanced diet. Into that you can include soya beans without any problem, even if they contain little bit of phytates compared to other food products. Now, goitrogens. Almost everybody who comes with thyroid problem, they come to me for weight loss. So they say thyroid, so I don't want to eat soy, I don't want to eat cabbage. I'm like, how much cabbage do you eat? 1 kg? No, na, little bit. It's fine. And when you cook it, it's gone. So don't worry about, they only know that much, and for them taking out one of the ingredients is not a big deal. But actually if you talk to them, nobody takes out anything. Only they eat it with guilt. That's it. They eat the cabbage thinking it's going to affect my thyroid, but they still eat it. So it's just fear and guilt, not really removing it from their diet. So with soybeans, once you are eating a diet which has iodine in it, sufficient amount of iodine, if whether you are hypothyroid or euthyroid, that means without any problems, you can take soybeans as part of a balanced diet. I never say take anything too much or too less. Normal. There should not be any problem as far as goitrogens are concerned, because we are not going to eat raw soybeans. We are going to process it in some way or the other, roasting, pressure cooking. Tofu, soy milk and all are anyway processed, heat treated, so it will not be a problem with goitrogens. Now, some people think there is a problem with isoflavones. They attach themselves to thyroid hormones and they are not available. But there are several studies which have been done, soy isoflavones and their effect on thyroid, and all the clinical studies, they show that it has no effect. Next, the other thing is, like I have also seen the trend, sometimes the thyroid thing will be in trending. Then about 2-3 years back, it was soy and men's fertility. That soy isoflavones, because of their estrogenic effect, have cause infertility problems in men. So in the beginning, I used to just give the example of China. They eat so much of soybeans, their population is so much. But now there are a lot of clinical studies where they've shown that taking even 40 to 44 milligrams of soy isoflavones every day for few months, the semen quality or the sperm quality, the semen volume, nothing was affected. In fact, they've seen that it reduces the risk of prostate cancer if soy isoflavones are taken regularly. So there is absolutely no this thing that soy isoflavones act as estrogens in humans. They have a very, very weak activity. Also, the activity is different. It is not exactly like estrogen. So there is absolutely no evidence. There are many case studies. You will have individual people telling, I drank 1 kg of soy milk and my infertility has become a problem with me and all. Please don't go on one person. Each of us are very different. If what affects somebody else, good or bad, may not work for us. So you have to take the basis of clinical studies or properly formulated animal studies, not just case studies or somebody's interesting way of talking about themselves. And okay, trypsin inhibitors, all my earlier speakers, the ones who spoke before me, talked about trypsin inhibitor. We are not going to take raw soybeans in any form. So once you do heat processing, the trypsin inhibitor is inactivated. We don't have to worry about it at all. Now, okay, as what we should aim to is a balanced diet where you have variety and foods in moderation. Then we are fine by including soy regularly, maybe 2 to 3 times in a week, or if you want, even more times, like 25 grams of soy protein every day is fine. There was a health claim which said it is good for our heart if we take about 25 grams, which will give about 40 to 50 milligrams of isoflavones. And also, isolates and concentrates are good, but if you can take it in a food form where you get dietary fiber, you get the micronutrients, everything, it's even a better way. Actually, there is no food in nature which is bad or which is, phytoestrogens or phytochemicals are there in plants so that insects and other things don't eat the plants or the grains. So everything has a purpose, and no food is bad. It's not suitable for us. We don't suit the food. If you keep that in mind and have a balanced diet in which soy is added regularly, you will get good protein, good quality protein, good amount of protein, because we do need protein. And we also will get other micronutrients and health benefits from the phytochemicals which are there in soybeans. So thank you very much for your attention. If you have any questions, I'll be here. You can ask me later. Thank you.
Thank you. Thank you, Dr. Kavitha. That was a nice and crisp presentation.